What's up guys, Dr. Greg here with Movement Driven Performance Physiotherapy. Today we got another hip mobility drill. This one, you may have watched some of our other hip mobility videos where we talk about the ball and socket joint and how we need to be able to get the hip, which is a ball and socket joint, we need that joint to be mobile in addition to having flexible muscles around that joint to be able to do a lot of functional activities, okay? So I see a lot of the time my patients come in with really tight hip flexors, whether it's a lumbar spine patient, a low back pain patient, or a hip patient, or even a lot of the times my knee patients have tight hip flexors. So if you haven't watched that video yet, I'll link it below. Make sure you master the kneeling hip flexor stretch because essentially we're doing the same thing, but we're adding a power band to help mobilize the joint, okay? So if we have tight hip flexors for a long time and we're not able to get adequate hip extension because this is pulling, that joint has a tendency to get stiffer over time, okay? So if this has been a chronic issue for you especially, then that joint's probably a little stiff. So this is just a way to enhance the mobility of the joint, to help the flexibility of the muscle, and these things feed off of each other, and we can't have one without the other, okay? So what we'll do is we'll get into the hip flexor stretch in that kneeling position, and we're gonna just add an extra component to it, which is using a power band to kind of mobilize that joint and do what we call an anterior glide and kind of pull that femur forward a little bit within that socket, which is your pelvis, to get a little bit more joint mobility, and it'll make your performance in the gym or out on the field that much better. All right guys, so like I said before, if you haven't learned how to stretch your psoas muscle, your hip flexor the right way, check out the link below, master that first, and then this is an added component to add on to it to make sure that the joint is moving well too. But essentially you're gonna be in this, what we call a half kneeling position, so on one knee with the other foot in front. And then you're gonna grab your power band, okay? And you're gonna step into it, and you're gonna kind of pull it up all the way as high as you can into the groin, and get it kind of right under the butt cheek there, okay? So then I'm gonna back up and put some tension onto it, and I'm gonna kneel down. Again, make sure you guys are using something soft under your knee, okay? I have an ab roller pad. I don't use a towel. Don't put pressure into your kneecap. Make sure that you're not hurting other things while you're trying to fix one thing, especially if you already have knee pain and this is why you're doing this exercise. So let's get back to it. So we're in this kneeling position, okay? This band is now pulling, if you look at the ball and socket joints, pulling it forward, okay? It's pulling it forward. That's gonna help increase my hip extension, which is going backwards there. Like you might see in the other video for the psoas stretch, what we need to do first is tilt the pelvis. I'm tensing my abdominals, but I'm not holding my breath, and I'm squeezing my glute, okay? So we'll do a posterior pelvic tilt. My pelvis, or my belt buckle, is coming closer to my chest. I'm flattening my back, I'm squeezing my glute, and then from there I'm shifting forward a little bit. Now if you shift forward and you lose some tension, then just get it further back, okay? Same thing, tilt, squeeze, shift forward, and that band is putting a little bit added stretch onto the capsule, which is this fibrous tissue right around your hip joint, okay? So start with 30 seconds, build yourself up to 40 seconds, a minute plus. Get up to 2 minutes where you're getting a really nice prolonged stretch of all of these tissues. That's the way to counteract all the tightness that you're getting sitting at the desk all day, doing one of these, shortening that muscle. We all sit too much these days, even if you're more active. So we need to stretch that as long as we can to counteract all that shortening we're doing throughout the day, okay? So again, put it underneath the butt, tilt the pelvis, shift forward a little bit, and let that band do all the work and just hang out, all right? Until next time, guys, I'm Dr. Greg. If you have any questions, let me know. Good luck with this one, guys.